Health officials are urging Americans to be cautious this Thanksgiving as the COVID cases rise nationwide. The 7-day average of new infections is more than 92,000. That's up nearly 30% over the past 2 weeks. Hospitalization rates are starting to rise, too. On Friday, the CDC endorsed vaccine boosters for all adults as authorities warn of a post-holiday surge of COVID infections. President Biden's chief medical advisor, Dr. Anthony Fauci, joins us now to sort it all out for us. Dr. Fauci, you know, I always feel glad to see you, especially during this time when we're all trying to figure out what in the world is happening here. Make it stop, because it seems like just when we make 2 steps forward, we're taking 2 steps back. The cases are up, the infections are up. What is happening?
Well, as you go into the colder weather, as you go into a season where people travel, where people congregate, and you have a virus that is as transmissible as Delta, you have an issue if you're not vaccinated. And even in a situation where we have highly effective and safe vaccines, we still, Gayle, we still have 60 million people in this country who are eligible to be vaccinated who have not been vaccinated, which means that the dynamics of infection, as you've shown on the screen, with a daily average of now 92,000 cases, we've got to be careful. That doesn't mean we can't enjoy the holidays. We can be with our families. If you're vaccinated, great. Get boosted. We now know that boosters, you're eligible to be boosted if you're 18 years or older for the vaccines that have been available, the 2 mRNAs as well as J&J. Go out and get vaccinated. Children, in fact, 5 to 11 now, 28 million of them are eligible to be vaccinated. You do that.
Dr. Fauci?
Yeah.
Do you think we're now at the point, in order to be fully vaccinated and be protected, you really do have to get your booster too? It's a hard pill for people to swallow, but isn't that the reality of the situation we're living with today?
Gayle, it's a great question. We want to make sure that we get the people initially vaccinated. We want to make sure they do that, because you don't want to have people be thinking, well, the vaccines are not effective. Right now, fully vaccinated is 2 doses of the mRNA and 1 dose of the J&J. What we're seeing, and we will move on these data, Gayle, when we get it, it looks like boosting individuals dramatically increases the level of protection. And that's the reason why you've heard me over and over again be very bullish about telling people, if you've been vaccinated 6 months ago or more, and you have the mRNA, get a booster. And if you have the J&J 2 months or more ago, get boosted. Whether or not that's going to ultimately be the optimal, it is entirely conceivable that that's the case.
Right.
Rather than worry about that now and confuse people, just get boosted if you're vaccinated. We don't want to confuse people about what is or is not fully vaccinated. Get boosted.
Now, Dr. Fauci, as we have these conversations about COVID and we keep talking about boosters and vaccinations, which I'm an advocate for, I have a question, though. What happened to the conversation that herd immunity can help us get back to normal?
Yeah, well, first of all, herd immunity is a concept that when you have a certain percentage of people, and we don't even know what that number is, Nate, so we got to be careful, of people who are vaccinated and fully protected, and those who've been infected and then have a durable immunity, that you will get a situation where the virus has no place to go. But we have a lot of moving parts here. We have 60 million people who are eligible to be vaccinated among adults who are not being vaccinated. You have waning immunity. It's a reality. We just have to face it. When you get vaccinated, you get a high degree of protection, but after several months, the immunity wanes. Even if you are infected and recover, the immunity wanes. So when you're talking about herd immunity, there are multiple different parts. So my recommendation for everyone not to be confused is, don't be looking for a number, which is going to be herd immunity. Just get vaccinated if you're not vaccinated, and if you are, get boosted. Clear message, no ambiguity.
Dr. Fauci, that is a clear message. I'm hoping we can have another clear message on my next question. We've got about 30 seconds left. A lot of families trying to determine whether they should ask their guests arriving for Thanksgiving to get tested. What do you say to that?
I think that's a reasonable idea for that extra level of protection. It isn't a firm requirement, but I think if you want to go that extra step, particularly when you're in a region where there's a lot of infection and people are traveling. It is not at all unreasonable to tell people to get a test, one of those rapid tests, 24 hours or so before you go in an indoor setting with people.
That's a PCR, not an antigen.
No, antigen tests are the rapid test. The PCR will take a while. Yeah, you can do an antigen test. It isn't the most sensitive of the tests, but it can tell you whether you have enough virus in your nasopharynx to transmit.
Yeah, I had a weird thing this weekend going to a gathering. They took one of those rapid tests. It first showed positive, and then there were 2 negatives after that. What should you believe if that happens to you?
You know, that's a tough one, Gayle. I mean, that's the reason why when you see
it
that,
shut down the room. Yeah.
Well, then you get a PCR the way Tony was just suggesting.
Okay.
I mean, the PCR is the much more sensitive. But if you want something rapid right away, you're getting ready to go someplace, you need to know in a half an hour, 15 minutes, get a rapid test. All
right, Dr. Anthony Fauci, good to see you. Happy Thanksgiving. I know we'll be talking to you again. Thank you.
Thank you
very much.
Take care.
Bye-bye.